Review Assembly Step 1. This section will deal with bone pathology. Now I must begin by doing a brief review of the normal development of bone and some of the various terms used in defining where and how lesions occur within the skeleton. The skeleton, as I'm sure you're aware, provides various things for the body, including mechanical support. It also creates your body size and shape. And then some things people don't often think of is it's extremely important in mineral homeostasis and also in the development and maintenance of hematopoiesis. Now, the biochemistry of bone can be dealt with very simply as a brief review prior to discussing infections and tumors of bone. Bone is essentially mesenchymal tissue that undergoes mineralization. It is composed predominantly of an inorganic matrix that, not surprisingly, is made up predominantly of forms of calcium, particularly calcium hydroxyapatite. And then there's an organic matrix that's made up of type 1 collagen and non-collagen proteins, including things such as osteocalcin and osteonectin. Our diagram here simply shows what a typical cross-section of bone looks like, with the compact tissue surrounding the regions of cancellous tissue, bone marrow, with the subchondral tissue found at either end of the bone where the joints develop. Now, for the various types of bone, what most of us think about are what we term the long bones. That is where you have a shaft, what we refer to as the diaphysis, with a head or epiphysis at each end. If there's any terms you need to remember in our discussion here of bone, it is the terms epiphysis and diaphysis. As when you're trying to determine what sort of bone tumor happens to be present, often even if you don't remember anything about the histology of the tumor, simply knowing if it's at the epiphysis or the diaphysis will help you break down the differential to a particular set of entities that are known to occur at one of those two places. We'll show you a diagram of that when we get into our discussion of actual bone tumors later in this lecture. Long bones are predominantly compact bone with spongy bone in the middle, and these are bones that are longer than they are wide. This makes up the limb bones, all limb bones except for those found at the ankles and wrists. The ankles and wrists themselves are the short bones. These are cube-shaped bones that are mainly spongy bone with a rim of compact bone surrounding them, as you see in this example of this skeleton here, showing what the metacarpals look like if one did a cross-section of them. Then there are the flat bones. This name is somewhat incongruous as these bones can be flat, thin, but also be curved. When you think about the flat bone, think about areas such as your skull, your sternum, and your ribs. Here what you often have are two thick layers of compact bone sandwiching spongy bone in the middle. Finally, there's one group that we simply term irregular bone. That is bone that doesn't fit into either of the previous three types. This generally tends to be a term that we reserve for the vertebrae and hip bones. This is just an example of bone here showing predominantly osteocytes with both the concentric and circumferential lamellae. This is an example of compact bone. You see here the lamellae, the Havresaurian canals, and also the arrows pointing to the numerous osteocytes scattered throughout the bone. This picture is an example of cancellous or spongy bone. This is bone that one would examine, for example, if someone had a hematopoietic disorder. You have the long, thin spicules of bone with the bone marrow interspersed between it. Now, the cells that are involved in the creation and resorption of bone, there are only a few that you need to know, predominantly the osteoblast and the osteoclast, and understand how they go to develop normal bone and also how they may develop into osteocytes. The osteoblast is responsible for the creation of bone, and then the osteoclast is responsible for the resorption of bone. There's a complex interaction between the two that keeps one's skeleton growing during the appropriate growth phases and then keeps it intact over the course of one's lifetime. Osteoblasts are located on the surface of bone. They synthesize and arrange the matrix that will eventually develop into the mature bone. And when they're completely surrounded by bone, they become the osteocytes, those cells with clear halos around them that we demonstrated in the previous slides. Osteocytes are the most numerous cells found within bones. They are encased by bone, but if you remember that cross-section diagram that we showed you a few slides ago, they live in that tunnel network called canaliculi, and they are important in maintaining and in remodeling bone. Now, you'll also notice the large multinucleated cells present in this slide as well. Those are the osteoclasts. Osteoclasts are phagocytic cells responsible for bone resorption. They are important again, similar to the osteocytes, in maintaining bone, but also responsible for bone's resorption. They reside in these particular little pits here at the edge of the bone that are called the somewhat romantic name of house ship's lacunae. Liberated matrix that comes from osteoclasts chewing up bone activates osteoblasts, having them lay down new bone, keeping bone resorption and formation in balance. This ends the first part of our lecture on bone pathology, part of the Falcon Pathology Review for USMLE Step